Ladies and gentlemen, this is a story that came out on my AJC, and this is going to be an eye opener right here because doctors, since the opioid plague has exploded around the country, doctors have been given limitations on the amount of opioids they can prescribe. But as you can see, this story, many of them are disregarding those limits and they're writing all these scripts out anyway. Hey, we're in America. Who follows rules, right? Doctors sidestep limits on opioids, authorities say. As states have imposed new restrictions on opioid prescribing, some doctors have devised dodges according to allegations in disciplinary documents and court records. Prescribe unnecessary drugs. In Florida, Dr. Lawrence Mark Skolnick reportedly said that to allay state concerns about doctors who prescribe only addictive and dangerous drugs to pain patients. He also prescribed small amounts of various seemingly innocuous medication, needed or not. That way, he was less likely to get flagged. So, write an opioid prescription and write a few other extra medications so it doesn't look so obvious. He also allegedly coached an undercover agent posing as a patient on excuses that could be used to get more than 72 hours worth of controlled substances at a time. Okay, so this doctor was arrested last year on trafficking charges, and the health department banned him from prescribing, saying he had written orders for more than, listen to this, 980,000 doses of controlled substances in a year's time. That's a lot of damage. Woo! Oh, man. He was just going crazy. Well, see, it's for the money. Every time these doctors write out a script, they actually get money from the pharmaceutical company. Sign up non-pain patients. Faced with new pain clinic rules, West Virginia, Dr. J. Derek Hollingsworth first notified patients in 2014 that he would close his clinic. Then he sent a second letter advising them how they could continue to get their prescriptions for chronic pain. He said he was opening a family medicine clinic, and if each patient could refer two new patients who didn't need controlled substances, he could maneuver around the requirement that the patient be licensed as a chronic pain clinic. The Board of Osteopathic Medicine alleged in 2016 it suspended his license, which is now listed on the board's website as expired. Ohio revoked his license. Prescribed methadone. In Pennsylvania, Dr. Stephen Charles Padence allegedly determined which drugs and which quantities to be prescribed based not on medical need, but on avoiding detection. Wow, these doctors are something else out here. Seriously, what's the difference between them and a street dealer? It's really not that much. It's just one is legal and the other one's not. But they both come up with sneaky ways to make sure they can get these drugs to the people so they can get paid. According to an undercover Drug Enforcement Administration investigation, he also reportedly liked to prescribe methadone because nobody looks at methadone like that. The DEA said he performed only cursory exams that best before prescribing opioids, medical board record shows his license was suspended last year. Give drugs at the hospital. In Washington, Dr. Victor O. Brooks repeatedly admitted some chronic pain patients to the hospital at night or weekends to avoid its emergency department, then administered IV pain medications. Woo, these doctors are something else. It's amazing. Everything they've done, technically, in my opinion, they should be jailed. But, they revoke their license, they get to still be free, right? Opioids administered in hospitals are not reported to the prescription monitoring program. Some patients had frequent hospitalizations. One had 36 in little more than 2 years. Wow. The board said Brooks failed to recognize that drug dependency caused the frequent hospitalizations and last year restricted him from prescribing narcotics. In March, citing his cooperation, the commission gave him the okay to reapply for his DEA registration. Hide the money. After Dr. Washington G.B. Bryan II got in trouble with the California Medical Board for excessively prescribing narcotic medications, he came up with a plan to continue to see people who would pay cash for painkillers. Bryan deposited the payments, about $478,000 in 15 months. That's a drug dealer. In 4 bank accounts in amounts that avoid federal reporting requirements. Often, he made deposits at multiple banks on the same day. In March, he was sentenced to 33 months in prison for circumventing the reporting law. Make drugs yourself. In Florida, Dr. Johnny Clyde Benjamin Jr. is accused of evading restrictions on opioid prescriptions by importing fentanyl from China and buying a tablet press and other supplies on eBay so he could press the pills himself, passing them off as oxycodone. After his October arrest, now this is a doctor, y'all. Now, again, what's the difference between him and what Mexico, China, and even drug dealers on the street in the US? What's the difference? After his October arrest, he was jailed with no bond. The Palm Beach Post reported a federal indictment accuses him of conspiracy to possess with the intent to distribute a controlled substance resulting in death. He is still actively licensed. So they didn't even take this doctor's license away. And he's responsible for a death. Unbelievable. Unbelievable, y'all. These doctors are no better or different than your run-of-the-mill drug dealer. Please tell me what you think. Please leave your comment and subscribe. And don't forget to hit on that notification bell. Peace, family.